Hi, this is Elizabeth Eikenberry, and I will be telling you about my proposal on why oral contraceptive pills should be available over the counter. 45% of all pregnancies in the United States are unintentional, and although the United States is one of the wealthiest countries in the world, this is substantially higher than any other high-income country. This is a huge percentage of women that fall victim to unintended pregnancy, and it can be partially blamed on the lack of access women in the United States have to contraceptives. In most states, to gain access to contraceptives, women must schedule an appointment with an OB/GYN, visit with the doctor, undergo a physical exam, and get a prescription that they then must fill at a pharmacy. This takes quite a bit of foresight and time and can be very intimidating for young women who must have a legal guardian in attendance. Women that work long hours, don't have a women's health doctor, or don't have access to childcare might not be able to attend an appointment like this at all. In recent years, there have been several bills introduced into Congress that would cause oral contraceptive pills, or OCPs, to be available over the counter at the guidance of the American College of Obstetricians and Gynecologists. Unfortunately, these bills have all been rejected. There are several groups of individuals that oppose this legislation in the United States, including several organizations that are opposed to the legislation because of religious reasons. The group that is leading the opposition of over-the-counter OCPs, though, are Democratic senators and representatives. These lawmakers usually state that they do not want OCPs to become available over the counter because they believe low-income women will have decreased access when OCPs are no longer covered by insurance. I have decided to address my proposal to lawmakers in Congress. I will refute some of the most common arguments legislators make against making OCPs available over the counter and suggest actions to those in favor of the switch that they can take to spread the word on the initiative. In 2012, the American College of Obstetricians and Gynecologists, ACOG, released a publication stating their opinion on the matter. The ACOG found that a potential way to improve contraceptive access and use, and possibly decrease the unintended pregnancy rate, is to allow over-the-counter access to oral contraceptives. This organization can be considered an international expert in this field, and they state several reasonings for why OCPs should be available to all women on a shelf at their local pharmacy. First, OCPs are safe compared to even the most widely used over-the-counter drugs. The rate at which women experience the most serious side effect, venous thromboembolism, is still less than a third as likely of the chance of developing the same side effect after a normal childbirth. Next, women who are interested in starting the use of OCPs can identify the risk factors associated with negative side effects easily on their own. Two of the most important contraindicators are age and blood pressure, and most pharmacies have automated blood pressure machines available for use in stores already. A research study recently found that self-screening is actually more accurate than screening done by physicians because patients are less likely to dismiss slight abnormalities. The ACOG stated, a different study conducted in the United Kingdom replicated the findings that women take a more conservative approach compared with clinicians and also demonstrated that none of the 328 women studied would have incorrectly used OCPs based on self-screening. Lastly, OCPs have been prescribed to millions of women from 3 different generations. The FDA cleared OCPs for prescription use in 1960, the same year Tylenol was first offered over the counter. Any long-term risk factors would have been identified years ago, and the general public is familiar with the basics of OCPs already, because someone they know most likely started taking the drug more than 50 years ago. It is important to understand that over-the-counter does not necessarily mean not covered by insurance. There are 7 classes of over-the-counter medication that are covered by insurance, one class being contraceptives, and the only stipulation for coverage is that patients must have a prescription. This means that if OCPs were offered over the counter, all women, no matter their insurance status, would be able to visit a local grocery store, convenience store, or pharmacy and purchase OCPs without a prescription. But women in severe financial distress would still have the option of continuing to do what they are already doing, getting a prescription at a doctor's appointment and picking up medication covered by their insurance from a pharmacy. Under the Affordable Care Act, all health insurance providers must cover contraceptive-related doctor's appointments, which assures that the option to get a prescription for contraceptives will always be available for women as long as this mandate stands. Ultimately, making OCPs available over the counter would have absolutely no effect on coverage for low-income women. Another commonly cited reason some oppose over-the-counter OCPs is the prediction that if women do not need to schedule their annual women's health appointment to renew their contraceptive prescription, then less women will attend these appointments at all. Researchers compared whether survey participants from U.S. clinics and Mexican pharmacies, where OCPs are available over the counter already, have attended their annual women's health checkup. While the research shows that U.S. participants were more up to date on their examinations, both countries had high ratios and were within 5 to 15% of each other on each variable. The study concludes that most women would still obtain a reproductive health preventative screening if OCPs were available over the counter. The last argument of the opposition I will review is that allowing OCPs to be sold over the counter would cause teenagers to have sex earlier or more often. Reports say that whether teenagers know how to properly use contraception or not has no effect on when they begin having or how often they have sex. Additionally, OCPs are currently being prescribed to treat several different health issues, and some of those, like acne, are not even related to reproductive health. Not only will keeping OCPs a prescription-only drug not affect teenage sex patterns, but it will be keeping women with health issues from getting better access to their treatments. The disinformation that is spread about over-the-counter OCPs is disheartening, but with work to inform the public on the many benefits of the switch from prescription-only to over-the-counter, there will certainly be an increase in support for the movement. The United States is often criticized for our colonial-era policies concerning social issues, but with a record number of female legislators in Congress, now is a perfect time to update our contraceptive policy. Making OCPs available over the counter should and must happen via bipartisan effort, legislation, and awareness campaigns. But until the public knows the truth about the issue, Republicans in Congress will have to continue leading the movement. I recommend that legislators use their many connections to urge political action groups to begin campaigns to make the public aware of the many benefits of over-the-counter OCPs, or campaign themselves in the upcoming election to spread awareness about the issue. I would argue that legislators should focus their efforts on informing their constituents about the issue, and not run negative campaigns on opponents, as we will need their support to pass legislation. I also urge lawmakers to make sure that their colleagues in Congress are well informed on the issue, and I believe lawmakers should work extensively across the aisle to begin work on legitimate and realistic legislative action. Of course, I believe legislators should continue putting forward bills that fight for over-the-counter OCPs. With an issue as important to women's health as this one is, opposers should be constantly urged to research this topic and update their viewpoints. I recommend legislators work to pass legislation on this issue no later than June 2020, so as not to postpone any required FDA research longer than absolutely necessary.